Hello and welcome. You're watching Newscentral. My name is Olisa Chukwumah. 2020 has been quite a year, you have to say, not least because of the COVID-19 pandemic. Well, joining us is one man who's been at the forefront of it in Africa's largest city, Lagos. We're joined by Professor Akin Abayomi, the Commissioner of Health for Lagos. Welcome, sir. Good afternoon. Well, sir, first off, where are we right now? This is the Ember months. After such a long time of battling the pandemic, where are we?
Well, we've certainly gone past our first wave. And we've got a grumbling, low-level transmission in community at the moment. We've put in a plan to mitigate a second wave. So we're seeing attempts of a second wave emerging, but we're just doing as much as we can to just interrupt it. And so far, it's just at a low level, and we believe, hopefully, that that's where we're going to stay. But we're coming up to the festive season, where there's going to be a lot of inbound traffic, people coming from countries that have a very high level of transmission. Festive season, you know, people get together, there are parties, people congregate. So we expect that something may happen, a gentle peak, if you like, a gentle wave, but we're going to put some things in place to try and mitigate that as well.
Well, Professor Akin, you've been at the forefront when this pandemic broke out, especially in Nigeria in March, with the daily updates and the briefings and the instructing people of what to do, where to go. In your thoughts, what do you think was the success for Lagos and instead for Nigeria in really tackling this pandemic? Because Lagos ostensibly did not become the epicenter of the continent for COVID.
Yes. So the success rate was that we anticipated it. We anticipated something. And then when we saw what was happening in China, and we saw it spreading across the world, that was our second level of anticipation. So we ramped up, and we were really ready for this thing when it came. And we went through, we hit it very aggressively, and we made sure that we stopped it from moving into a free-for-all community transmission. Now, I think Lagos also, or this part of sub-Saharan Africa, is fortunate that a lot of the people that live here are young people. And we know that it has a slightly better outcome in younger people. So that early aggression plus the demographic profile of the Lagos population probably helped us to get over this and see the kind of profile that we're seeing now.
Yeah, it was quite an interesting period because even at some point yourself, you had to isolate during this course. What was the experience like, leading that charge and still having to stay?
Well, you can do a lot virtually. This phone that you have here, is very dynamic, it's very powerful. Even though I was locked away for a few days, I could still command the troops, from my house, digital instructions, the phone, the computer. So it wasn't that bad. It gave me a few days to rest, by the way.
There's been talk about, testing. During this spike of the pandemic, or the rise of it in Nigeria and Lagos, to be more precise, there was talk about testing, contact tracing.
Yeah.
Where are we with that, especially from the Nigerian Institute of Medical Research? Talks about new testing dynamics. Where do you think we are right now?
There is an evolution of testing.
Okay.
What type of tests can you do? The speed with which you do your testing. The technology is changing. There is the PCR method, there's now the rapid test, and there's some newer technologies that are coming out. But we still have the gold standard, which is the PCR. And the rapid tests are getting a bit smarter, but they're not quite there yet.
To avoid things like double negative or false positives.
So with a pathogen that can cause severe outcomes, you don't want to tell someone they're positive when they're negative. And you don't want to tell someone they're negative when they're positive. The consequences either way can be disastrous.
Yeah. Right now, we just had news a couple of days ago. The company talking about Pfizer with their partners have announced according to the UK authorities, the COVID-19 vaccine, 95% they say effective is clear to go and roll out can begin as at next week. And they've been talked about other vaccine candidates like the Oxford vaccine or the Moderna vaccine. Where do you think we are in terms of this part of Africa for vaccination? Do we expect, perhaps something might be extended to these parts?
Well, there are two ways to talk about this question. First of all, Africa needs to develop its own vaccinology strategy.
Okay.
In other words, we need to be in a position where we can use our technology to develop vaccines. We used to have some of it, we've more or less lost it. We need to get it back. Right now, as you can see, we're relying on the international community to produce vaccines that we may use. Now, when you develop a product, either a drug or a vaccine, you've got it just like COVID responds differently in the northern hemisphere as it does in the southern hemisphere. A vaccine may behave differently in different parts of the world. So you can't use copycat results and just translocate them to a new environment. It may be working 95% in Europe. It may not work here at all.
And there's also talk about storage and
and then there's the
refrigeration.
logistics.
Yeah.
So these are all the issues that you have to contemplate. Now, normally it takes about 3 to 4 or 5 years to develop a safe vaccine. When you're developing a vaccine for a public health crisis, a global pandemic, where you are deploying it to save lives, then you are prepared to take the risks of a shortened risk profile. So what is the benefit of taking a vaccine as opposed to not taking it? If you don't take it and you catch a pathogen and that pathogen is likely to kill you, right, well then you don't gain anything, you die. But if you take the vaccine and that vaccine gives you an easier profile with the disease and probably saves your life, then that is a calculated risk benefit, and you might choose to take the risk. What is the risk with a vaccine? Anything new and anything you inject, it's new and you inject it, you can't take it back. Once you've injected it, it's in the system, all right? It may protect you in the short term, but maybe 2 or 3 years down the line, you start to develop a complication.
So it's not necessarily a game changer.
It could be a game changer in environments where transmission is very high and people are dying.
Okay.
But in this environment where transmission is high, but people are not dying, all right, we've managed to interrupt it to the extent that we have a low death rate in this environment. You have to be able to weigh up the risk benefit of deploying a vaccine that has a very limited understanding of its risk profile, its safety profile. How safe is it? We only have 3 months data.
True.
I certainly would not be keen to take a vaccine for which we as scientists only have 3 months of safety data. Normally you have 1, 2, 3 years of safety data, and even then, sometimes we still get complications that we pick up years after you've received the vaccine.
Now, we are in the ember months. We are looking towards 2021. What do you see?
Well, I see that we learned a lot of lessons from COVID. I see 2021 being a year of sitting down and thinking, looking back to see what we did right, what we did wrong, strengthening our health systems, developing our capacity. I think we're lucky with this one. The next one may not be such a...
Should we expect another one?
Well, I mean, the WHO and all the experts in emerging infectious diseases say it's the nature of the way the world is going at the moment. We're going to get pandemic after pandemic because we've destroyed our ecosystem, our populations are expanding, our food production is abnormal. There's all kinds of things going on, climate change, that are promoting the emergence of zoonotic events or emerging infectious diseases. So, as a population, as a global population, we are expecting wave after wave after wave of different types of events. So we've got to learn from Ebola, we've got to learn from COVID, we've got to strengthen our systems, we've got to train our people, we have to build the right infrastructure. But we must also go back to the root cause of these kinds of things. What is the cause of these kinds of waves of outbreaks coming and going, coming and going? And the major issues are environmental degradation and unplanned urban and rural expansion.
Being part of a government,
Yes.
especially health commissioner, in a pandemic such as this of 2020, and the pressure that comes with it, what would you say?
I'd say if I knew, I wouldn't have signed on the dotted line.
Well, thank you very much, Professor Akin, Commissioner of Health for Lagos State on Newscentral. Thank you so much.
It's a pleasure.